Hi, good morning, Alan. My name is Mihira. I'm your invigilator for the OET-speaking session on the 27th of May 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Alan Arthur.
And what is your candidate number, please?
My candidate number is 253815887.
Thank you. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
Why did you decide on a career as a nurse?
I come from a long line of nurses. Both my grandmother and my mother are nurses. Growing up in that environment, and seeing how much they love what they do every day, is both inspiring and motivating. I love the challenges, and thinking outside the box to come up with solutions keeps me excited and engaged. I'm proud to continue the tradition of nursing in my family. Above all, knowing that I'm truly making a difference in people's lives is what truly makes it all worthwhile.
What's the hardest thing about being a nurse?
To be honest, I believe that the emotional strain is the hardest part of nursing. When you're dealing with patients and their families, it can be tough. You often have to deliver difficult news or support people in their darkest hours. I've found that the more mentally healthy I am, the better I can cope with these situations. For that reason, I focus on establishing a solid work-life balance and taking time out to rest when I need it.
What do you find rewarding about being a nurse?
As a nurse, I support people during the toughest periods of their life. For me, being able to give patients peace of mind and hope when things are hard is endlessly rewarding. Helping to calm people's fears and giving them the information that they need is always a pleasure. I realize that it is equally difficult for a patient's family members, so I also dedicate time to giving them the advice and support they need. I can't imagine a more rewarding and fulfilling role. It is a career that keeps giving.
Would you say you're a team player?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team, because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivation, and am equally comfortable working alone.
How do you explain complex medical terms and procedures to patients who don't have a healthcare background?
Since patients have different levels of understanding regarding medical terminology, I use a combination approach when speaking to them. Usually, I'll lead off with a formal term and couple it with an informal term or description, depending on the situation. For example, I may tell a patient that a medication is used to treat hypertension, also known as high blood pressure. That introduces the phrases physicians may use when speaking with a patient, while using terms that feel familiar to ensure understanding.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, I'm Alan Arthur, one of the nurses, working here in the emergency department. What can I do for you?
Hi Alan, I have been waiting here for the last 1 hour. But I couldn't get consulted. It would be really helpful if you could make my consultation as fast as possible, please.
I am sorry for the long wait you had. For better communication, how may I address you?
You can call me Mihira.
Mihira, could you please tell me the reason for your visit?
Well, nurse, I'm here because I have severe abdominal pain. It started this morning, and it hasn't gone away.
That sounds like it is really hurtful. Mihira, we are doing our best to see you as soon as possible, but we have a very busy department today. We had some critical patients who needed urgent attention, and we are also short-staffed. Please bear with us.
I understand, but it's really hard to wait when it is so much pain. Can't you do something for me?
Of course, I can. Let me ask you some questions first, so I can assess your condition better.
Okay, you may please.
Thank you. Mihira, when did the pain start, exactly?
It started around 8 a.m. today, when I was having breakfast. It was sudden and sharp, like someone stabbed me in the stomach.
That's hard to hear. Well, where exactly is the pain located?
It's right here, in the lower right part of my abdomen.
All right. And does the pain radiate anywhere else?
No, it stays in the same spot. But it gets worse when I move or cough.
Okay. Mihira, on a scale of 1 to 10, where 1 is no pain, and 10 is the worst pain imaginable, how would you rate your pain right now?
I would say it's a 9. It's really unbearable.
Okay, that's very high. I recognize that this can't have been an easy thing for you. Incidentally, do you have any other symptoms besides the pain?
Well, I did vomit once after breakfast. And I feel a bit feverish and sweaty.
Okay. Do you have chest pain?
No, nurse. I don't have chest pain.
Did you feel dizzy?
No, nurse.
Okay. Mihira, do you wish to add anything else?
No, nothing to add.
Okay, thank you for telling me. And I appreciate you being calm all this time. Now, kindly be patient for some more time. I assure you that it will not take too long to be seen.
Thank you. But nurse, it is getting very difficult for me, and I don't think I can hold on to it so long. It would be great if you could provide some medications and self-care management advice so that I can cope with my situation.
Your situation is understandable. However, Mihira, I would like to inform you that, based on your symptoms, it's very important that you see the doctor as soon as possible. It is because your pain might be due to some complications, or can lead to complications. Moreover, it can be caused by several problems, and it can be a serious condition if left untreated.
Oh no, that sounds scary.
Mihira, I didn't mean to scare you, but to convey the importance of being assessed by the doctor. The physician can find any underlying cause that exists for your condition and can provide you with the best possible treatment to rectify it.
Yes, I got it, nurse. It's okay. Nurse, is there anything you can do to help me until then?
Yes, there is. I can offer you some paracetamol or acetaminophen to ease your pain a bit. It's not very strong, but it may help you feel more comfortable. Would you like some?
Yes, please. Anything that can help me?
Okay, I'll get that for you right away. In the meantime, please try to relax and breathe deeply. If your pain gets worse, or you develop any new symptoms, please let me know immediately. There are only 2 patients left before you, so you should be seen by the doctor soon.
That sounds great. It gives me relief. Anyway, I will wait as you suggest.
Thank you for your understanding, Mihira.
Thank you for your help, and explanation. I appreciate it.
You're welcome. I'll be back soon with your medication.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.